Well, howdy. You know, with the epic battle that Dr. Elizabeth Potter, a Texas physician and breast surgeon, is bringing to light in her battle with United Healthcare and their both peer review process as well as their denial process, I'd mentioned to a colleague that that's not the only technique that insurance companies are using. Another one is the narrow network problem, and my colleague didn't quite understand that. So I think it's an important concept, and I want to spend a moment on it. Insurance companies are now using a narrow network philosophy to take physicians out of their network in order to try and pay them out of network rates, but frankly, to deny them out of network coverage. You know, in the old days, an insurance company would want to have more physicians and more hospitals on their plan because it made it more attractive to the patient who would then sign up for their plan. But nowadays, it's not the patient that's really shopping, it's the employers. And the employers just want the cheapest bottom line. And so insurance companies have realized that they can move into a market and say, yes, this hospital is in network, but they don't even put a single physician in that network. And they form these very narrow networks of coverage that make it look wide, but it is not. Furthermore, the average physician, you can sign up with an insurance company and they can drop you with almost no notification. In fact, the list of physicians who are in network changes daily. It's not even accurate 30 days later. And physicians, oftentimes, unbeknownst to the physician, drop on and off of these insurance networks without us even really knowing. And with all the different insurance companies, there's really no way of an individual physician keeping track of what network they're in and what insurance plan they're on and what not, which one they're not. And that makes it very tough for physicians. It makes it even tougher for patients. And so while I certainly support no surprise billing legislation, a lot of that was written to favor the insurance companies such that they'd rather the physician not be in network and pay at an out-of-network or challenged a physician out of network and then go to arbitration and hope that they do better than even network prices. And that saves the insurance company money. It delays care, delays patient access to care, and certainly puts the physician through a huge number of hoops. So insurance companies are certainly guilty of forming narrow networks now, reducing the number of physicians that are in their network, a lot of times putting the hospital in network, but many of the physicians in that hospital not on network. And that's not a physician problem. That's an insurance company's strategy to save them money so that they can go to arbitration and pay lower rates, that they can deny care, and that they can delay payment. And so physicians, on behalf of patients, need to really fight this narrow network philosophy because it limits access to care, it delays care, it delays payment, and it really puts the patient and the physician through a huge headache.